Hello, everybody. Thank you for listening to My City Talks. This is the My City, My Health podcast, and I am so excited to be here with the homies to talk about something that's super important. So we're going to get into it today. But before we begin, if you guys can tell us your name, what gets you up in the morning? And what do you do?
Yeah. So my name is Jessica Duncan. I am the program director for the Alzheimer's Association Iowa chapter. I am also a certified dementia practitioner, and I get the honor and privilege of helping with our mission work across the state and helping caregivers like myself. What gets me up in the morning? I have two little boys. I have a 4-year-old and a 6-year-old that keep me busy and young and on my toes. And I get to tell the story of their papa and how we've been impacted by dementia every day at work. So I love my job.
Awesome.
Yeah.
And I'm Keisha Ward, and I am the Director of Development for the Alzheimer's Association Iowa chapter. And in my role, I oversee our 19 walks. That sounds like a lot across the state, but it's not just about walk. It's about, building that momentum, getting people excited, rallying folks together, leading up to it. And then what gets me up in the morning? God said, get your tail up and go and do what I told you to do. That's what gets me up in the morning. I got to get up and do exactly what it is that I'm put on this earth to do.
Yeah, I love that. And you know what? I've come to learn so much since I've just been listening more about your mission, being a part of meetings, talking about dementia and Alzheimer's. Things that I already knew, but a whole lot of that I didn't know and I didn't even understand. And the more you learn about what you guys are doing and the reason why, it's like, man, we need to let more people know about this. And with that, Jessica, I want you to give us an overview of kind of like the current impact dementia is having here specifically in Iowa. Can you tell us a little bit about that?
Yeah, so to kind of back up a little bit, the difference between dementia and Alzheimer's is something that I think is not as explained as much as we probably should be. So dementia is the umbrella term, and there's multiple types of dementia, and Alzheimer's is the most common type. So Alzheimer's is about 60 to 80%. So in Iowa, we have 62,000 people over the age of 65 with an Alzheimer's diagnosis. So that's kind of impact of people with a diagnosis. To give perspective to that, there's so many more people that have memory impairment, cognitive decline. My dad was 53 when he was diagnosed with a different type of dementia, so he's not even in that number. So it is much larger than 62,000, but at least that's a good parameter to start with. And then at least 80,000 unpaid caregivers in our state are trying to help those 62,000 Iowans.
Oh, what's so scary about it? And we kind of talked about this before. Is that stigma around it? 1, 2. There's this feeling of when someone's getting older, or if their mind maybe slips, or they don't remember a whole lot of things, or that's just natural aging. Right? So you don't even do anything, and sometimes until it's too late. And especially, within the Black community, we're seeing a lot of that, waiting until it's too late, and not getting the proper care. And on top of that, the caregivers that you're talking about, we don't talk a lot about the caregiver.
No.
As much, especially with something like any range of dementia that we're talking about. The caregiver, what they do for free.
Right.
For free.
I mean, and I became a caregiver professionally at the age of 18, but personally at 26. So I just was trying to figure out, what do I do? What are resources that are available? Not only for the people that I got to take care of professionally, but also as a new mom at that point,
right,
and figuring it all out. I think that it can feel very lonely too, but if you think about 62,000, I'm from Council Bluffs. That's
right,
the population of Council Bluffs. Like if everybody in the state lived in one city, it would be mine. And that just, I think, brings such a wow factor to how many
Yeah.
people are impacted, for
It makes
sure.
you think about it a whole lot differently.
Yeah.
When we look more closely, at the data, which populations or counties in Iowa are currently most at risk for developing dementia?
So the number one risk factor is age. So when we use 65 throughout a lot of our statistics, 65 is the magic number that puts you at highest risk. So our population, or our counties, that have the most people over the age of 65 are who are at highest risk. So most of our rural communities are actually the highest counties. So Monona County is number one. Ringgold County is number one in the state. It's about as far south as you can go. Monona is number two. My family is a farming family, very rural community, and they're in Shelby County, where we see it as number 10 at the very bottom of the top 10. So most of our rural counties are where we're seeing the highest impact.
And then I would say, so we have number one, right, is age. Number two, rural communities. And then number three, Black folks are twice as likely, right, to be impacted by Alzheimer's. And then the Hispanic population, 1.5 times is likely more than the white population here. So when, you do get into some of the racial challenges, right, and experiences, and you have rural folks where, their level of access obviously is significantly reduced. So that's based on, right, location. And then for us, when we think about, perception within the healthcare system, we talk about this all the time. Alzheimer's is no different from that, right? Like, what do you mean? Just like you said, this is just natural aging. Like, we all forget as we age. There's nothing wrong with us, and there is we also take care of our own. So if we do see a decline, we don't talk about that outside of the house. That stays right up in here.
It's nobody's business.
Nobody's business. The immediate family, we're not going out there. And we show up, Black folks, once we do show up and we recognize, oh my gosh, something is happening, something is declining, 8 times out of 10, it's too late. And it's too late for the level of support that's needed. It's too late for any cognitive, when you think about support, obviously it's around the caregivers, other cognitive supports, right? You think of memory care centers and, right, things like that that could help along this journey. But when it comes to the Black population, a lot of people don't even realize that, right? And it's like, I'm not sending my family away. Right? Or it could just be the lack of resources. Nobody's coming in my house. Why would I have somebody coming into my house to care for someone that I should be caring for?
Right.
Because that's what we do culturally.
Yeah. And there's, going back to the resources, one, before I go there, I want you guys to kind of talk about, we talked about a lot of what happens when you don't get access to the resources, but can you shine a light on the difference when you catch it early? Like, what is that? Because I think we talk a lot about the negative a little bit, like, hey, we always wait too late. But talk about what happens when you catch it earlier.
Yeah. So with the way that science is currently, we can technically do a blood test 20 years in advance from when you see symptoms to tell you if those numbers are showing likelihood of mild cognitive impairment, which is typically the first diagnosis before you find out it is truly dementia or Alzheimer's, or being able to say, yes, definitively Alzheimer's is coming. And so how amazing would that be? If you do the math, my dad was 53, 33 is 20 years in advance, right? I could be knowing now, which is crazy. And so if we're able to catch it, whether or not it's with that blood test, with scans, our mini cognitive assessment when we typically go to our annual visit, we can see it early. And there are 7 cities in the state of Iowa that have treatment available for those that qualify and find it early. Whereas when I became a volunteer in 17, there was only an oral pill that you could take, and that would just keep the normal as long as you normally could. Now we are seeing people catch it early, to get those things in their brain that aren't supposed to be there, not to develop at all to begin with, or we're seeing decline of those. Which, I'm not a doctor, a nurse, a pharmacist, a social worker, but just to kind of make it so that it makes sense to me, that's a way to kind of say, wow, early detection could help so much with so many families like mine.
And that's all great, but what is so, I guess not, I wouldn't even say upsetting, but it's like there are so many households that have no idea this information is out there. How do we get people, or even, I'll even put some of this on the healthcare system, because we talk a lot about diabetes, we talk a lot about high blood pressure, which are all things that, we need to be talking about.
They can help lower your risk of Alzheimer's.
Exactly, right?
Yes.
But that conversation around Alzheimer's or dementia period, crickets. There's not a big conversation unless you're in that world, right? How do we take this conversation out of that world, out of the purple universe, right? And bring it to our communities and say, hey, let's see if you're eligible for this. You need to be talking about this. We need to be bringing this to our communities, because grandma can live longer, you can live longer. These things need to be a high priority. What do we do there?
Being out in community, I think, is a big thing. Hopefully you see more and more purple people when you're out in the community. But one of the biggest things that I think can be helpful for anyone listening or talking to someone is there are preventative things we could be doing. Heart health and brain health go hand in hand. So those preventative things that we're doing for our heart health really transfer over to brain health. And one of the best things you can do is exercise, which is good for your heart and health. And I know of a really good walk that's coming up at the end of the fall season. So our 19 walks across the state are really great ways that we're in the community sharing that information, as well as inviting primary care to the conversation, inviting them and helping them know how they can bill for it too, so that they can see it from the community and have it in their homes.
And another, and to add to that community piece, we really have to show up in all of the different spaces where those opportunities exist. I mean, when you think about it, I don't know, later this month, I'll be hosting, be the host for a fashion show. That's going to be the perfect opportunity to talk about, right? And when I say talk about, it's in a way that helps connect people to it. Like that first, second, maybe even third introduction, not everyone wants to just hear some numbers thrown at them, right? They're like, no, like connect this to me in a real way. Like, make me be more curious about this and make me more excited about coming along for this ride. And then I'll also be that voice behind the Alzheimer's Association, right? So we literally have to show up in these different spaces because people need to know how it impacts not just them, but the employees at a company. Over 50%, of employees, they have some type of connection to Alzheimer's or some other related dementia, right? And so we think about, there is someone that you could be working with every single day. You don't know this. They're caring for someone.
Right.
They may have lost someone the year prior, right? They may be experiencing some of the signs right now, and you don't always know that. And that's something they're experiencing. But when we start talking about it more, that's that first step, and then we start doing something about it, right? Because it's not just about walk. I said this earlier, but it's about every way that we engage with the community, building community. We're really supporting each other leading up to walk day. Like, we want y'all to come out to happy hour with us and just hang. You're not gonna hear a presentation. It's just getting to know us. We want to get to know you even in more informal ways. So I think sometimes just throwing numbers at people can also be a turnoff in that initial, right? Like understanding of what is Alzheimer's and what do you mean? What do you mean is recommended now that you should start getting tested between 35 and 45 years old? Because I'm in that.
Right, man. Right? And also, like, there has to be, I'm not going to pull up on you just meeting you, like, hey, what's up? You want to take this mini call real quick?
Right.
You know, like, there has to be, you have to build, even though it's an urgent thing, if you don't build a community, it's not going to happen, because it is a scary thing to talk about. Regardless of what you know about it, you may know it's the right thing to do. It is still very terrifying. So luckily we have a trusted source in our community, right? But people need to know that source is there and how they can reach out to them. Before we step over to this next piece, you see how I did that? You see, bars. First of all
the bars.
I do want to talk about, because I think it is very important to talk about, there's 14, where did it go? Where did my notes go? 14 modifiable risk factors.
Right.
Could you break this down for our listeners? Because I think that's very important for someone listening to kind of know what those are, and so just some of the steps they can take.
Yeah, so this is a little bit numbery, but I promise it's worth it to listen to.
It's worth it.
So a lot of the funding that we do is for research, right? A lot of it is to find these answers to what we can do now to prevent this from happening if at all possible. And so in 2024, with the Lancet study, we found 14 things that equaled up to 45% of dementia patients having a modifiable risk factor. So almost 50% of them fall underneath these 14 things. So in early life, less education was 5% of those. So making sure that we're active in early life, learning new things. Sudoku is something very, very simple that any of us can put on our phone and do an app. So less education was at early stage. In middle life, hearing loss was actually number one of all of those, 14 in that stage. So 7% of people with hearing loss, that was a modifiable risk factor for them. Wow. So I know when my husband is telling me that he can't hear me, I'm like, I'm a little worried about you, let's keep. So hearing loss, you wouldn't think of that as being something. So in the heart health world, so high LDL cholesterol is 7% of that as well. So making sure that we're watching our heart health, because that equates to brain health. Depression, actually, so a mental health component does have a lot to do from the chemical imbalance of the brain earlier on in life as well. So traumatic brain injury. So my dad was a mixed martial artist. That was one of the biggest things we thought was definitive for him, but it's not always the case. About 3% of people in midlife have that. Physical inactivity. So, when we talk about heart health,
sedentary
we hear that
lifestyle.
too. Yep. Diabetes was 2%, smoking 2%, hypertension 2%, obesity 2%, and then excessive alcohol. We had a couple of patients when I worked in the memory care that were alcohol-induced dementias. And so middle life, we can make some of those changes and seek help. And then in later life, the last three are social isolation, air pollution, and vision loss. So those are things, especially with social isolation. Over COVID, we saw a huge tick up with dementia cases. And so this study is really honing in on how much it's important to do things like this and learn along the way.
Yeah, and I'll make sure that I have that article linked into the episode so people can easily get access to it.
Yeah, because we're, folks aren't asking you to be extroverts, right? When we think about isolation, it is, being able to really spend time, even if it's spending time with one or two of your closest, right? People, family members, friends, neighbors, whatever that looks like. And I know this is difficult for a lot of people, but we got to get that sleep. I'm sorry, y'all, but we got to get that 7 to 9 hours, average of 8. We know the impact overall, right? Like, we feel it when we wake up when we don't get the sleep that we need. Just over a week, right? And I don't know about anybody else. And it's not just sleep, it's good sleep.
Right.
Right? Not the tossing and turning. We need you in REM sleep.
Yeah.
That good deep sleep. So those are two things, because I know, you hear oftentimes whether folks are introverted or not introverted. It's like, sometimes I just like to keep to myself. It's like, okay, don't do that for too long.
Right.
Yep.
Right? Connects with
Get
people.
out here and touch earth a little bit. Touch
Yes.
Right.
Yes.
You know something I've been doing too? Me and my wife were talking about this a couple months ago, is doing things with our opposite hand. So I'm right-handed, eating with my left hand, or writing with my left hand. Just the little things like that, outside of the apps too. Just little things like that to, get the brain
Force
working.
your brain to work a little bit harder, because that falls literally in line with, low education that Jessica was talking about, right? We really do need to keep our brains moving. I mean, I know I finished grad school and I said I'm not reading another book again, but
I'm done.
Unless I absolutely have to. But just like there's so many different ways that, we can be working our brains.
Yeah. So, Keisha, let's talk about this walk.
Yeah.
Tell me about it. When is it?
Yes.
Why is it important?
Yes.
I know there are a lot of walks going on throughout the state of Iowa, all at the same time. But flowers to you all, because from what I understand, there's like 1,000 walks and 2 people working on them. So good.
19 does feel like 1,000. Okay, that's real. Okay, I'm gonna give you that. 19 does seem like 1,000, especially when you think about Iowa.
Yeah.
I think we have like the second most walks in our region. So you think about us, Wisconsin, Minnesota. Wisconsin has the most in our region, right? And so walk for us for Des Moines. So yes, we have 19 walks. They all take place between September and October, right? So we're getting it all done in this shorter time frame. But our Des Moines walk is Saturday, September 27th. That morning, we're super excited because historically, we've been at the Capitol for this walk, right? And so our walk manager right here in Des Moines, Jess Klember, who's
Put the camera
around
on, Jess.
here.
She's right there.
She did great work on transitioning us, from the Capitol over to Principal Park in downtown Des Moines. So how awesome is it for us to still stay centralized? You hear Principal Park, you hear fun.
Right.
Don't get me wrong. Okay, the Capitol's fun, we know. But you hear Principal Park. You also hear so many growth opportunities there. So we plan to have food trucks. We plan to have live entertainment. Right. We don't want this to just be a walk.
Right.
Like, it's all the ways that we could be in community with each other. Right. So many photo opportunities, signs throughout the walk route that's encouraging folks as they're, trotting along, and then the mini cognitive assessments. That is our goal for this year, something that we have never done for the Iowa chapter before. So that is something that is super exciting. And and you already said this. We know it sounds scary when you hear Alzheimer's. I mean, for goodness sakes, the moment that someone says, dang, what? I can't remember it, right? Like, what does that, like, sometimes you go, oh my gosh, I hope I'm okay, right? And so to show up to something, you're like, oh my gosh, there are going to be many cognitive assessments. You don't have to get them done. It's just a really great opportunity to possibly, get that referral of go see your primary doctor, right? Start having these conversations, because this is the time for us to start that for early detection. So this is we are not keeping y'all all day. This is just a 2-mile walk, okay? All of our walks are anywhere from 1.5 miles to 2 miles across the state, and we really are excited to just build that momentum and be there together, celebrate. I mean, this is huge that we have 2 treatments on the market, right? Like, this is our goodness gracious. We just completed our 10-year strategic plan, and we're transitioning into our new one for the entire organization, not just locally. And who would have thought that in that this last 10 years,
Right.
that treatment would be on the market for those that are diagnosed early onset. So this is just like that one way, I feel like, too, to celebrate that.
Mm-hmm.
To bring people together, and between now and walk, getting folks excited about raising funds that'll go exactly where it needs to go. It needs to go to research. It needs to go into programs, right? And that is where a lot of people don't realize this, but about 80% of them dollars, they go straight to exactly where the
where it needs to be,
where they need to be. And so let's celebrate that on September 27th together. And just keep the momentum going, and who knows, man, somebody's next $50, $100 really could like be part of that next breakthrough for us. So,
and I want to mention too the flowers. You talked about the flowers. So everybody that comes to walk gets a flower, and you can't get this any other time of the year. It is a exclusive thing on walk day, and everybody can get a flower. So say you don't have a connection to the disease. I hope you don't. You get an orange flower to see me out of a job. Like, I would love to not have a job anymore, right? Just support our mission. There is a blue flower for dads like mine that had the disease. There's purple flowers in case you've lost someone to the disease. There's a yellow flower for our caregivers, and then there's a white flower for the first survivor of the disease. And just seeing all of these flowers together is something that, it's like the largest support group in the world in that day. And it just takes your breath away. So if you bring your kiddos, bring your friends, it doesn't cost anything to register today, and you get a flower to bring home and really remember why we do what we do.
Yeah, register, get people out, walking, being in community, because that's what it is all about.
Yeah, and registering to engaging with us at that level also means that obviously we want to continue to get the word out to the entire community, but you do get to see a lot of the things that are happening with, happy hours and all of these other things that we're pulling together and telling folks to show up to, and the walk kickoff party, right? Which is going to be July 8th at Confluence. I know this. July 8th at Confluence, but it's just exactly what it sounds like. It's a party in preparation for Walk in September. So be on the lookout for more information about that, and what drinks might look like. Now, we ain't going overboard because we already heard about the alcohol piece, right?
Just a little bit.
Just a little bit. Maybe some beer. Okay. Yeah.
Awesome. Well, I will make sure I have links so people can sign up for the walk on this episode. Is there a link for if they're not in Des Moines? I know there's other walks in the state, so I'll make sure I have if I can get those links, get those to everybody as well. Before we get you guys out here, I know you have a personal story to the disease, and there's somebody listening right now that is feeling a little bit better, but they don't know how to take that next step. What would you say to that person to get them to really feel encouraged to go all the way?
That's a good question. Listen to your gut, and know that if you're seeing something, write it down, and that you're not alone. I think that's one of the biggest things as a young caregiver. I was like, how can other people be seeing this? I have to be the only one, right? Mm-hmm. And we heard today that you're not. And so being able to know that had we caught it early, my dad could have been a part of the solution with research. He could have helped us find answers, and we just were scared to talk about it. And I think that's the biggest thing, is know that you're not alone. We have people that are available 24/7. So whether or not it's me, it's Jess, it's Keisha, we also have a whole care team available 24/7. So I'll give you the phone number for that to put in the link too.
Yeah, 100%.
But just talk about it, write it down, if it's something that you're worried about for your person, and know we're at a much better spot even 5 years ago than we, originally thought we could be. So talk about it. Don't just keep it inside, and know that there's good, valuable help that's available here right in Iowa.
Yeah. No, you guys, Keisha, Jessica, thank you guys so much for joining me on My City Talks. Before we get going, for anybody listening or watching that wants to connect with either of you, learn more about the organization, where can they connect and reach out?
So alz.org/Iowa has all of our contact information, our events, all of the 60 support groups across the state, ways that you can get free education in your church, your community groups, your conferences, anything like that. And then we also have more information at Walk there too.
Everything is there.
Everything is there.
Yes.
Everything is there. Again, thank you guys so much for being here. Again, my name is Corey Dion Lewis with My City Talks. We are a community on a mission, and the mission is just getting started. I'll holler at you next time.